Welcome back, everyone, including those that are joining us remotely. I'm super excited to hear this topic. It is titled, "A Patch a Day Keeps the Hackers Away." And how exactly does that play out in the healthcare? So I'd like to welcome Dr. Cavoukian, Alia Shahidi, and Nguyen and Coode to the podium. To the panel for discussion.
Oh, thank you so much. Good morning to everyone here, and good afternoon to many of our people that are online and global today. We are talking about healthcare. I have an amazing panel who will introduce themselves in a moment. Healthcare, of course, affects everyone. We all have health. But healthcare also matters in all of our companies because we tend to also collect sometimes health or medical data we may not be thinking about. So if you are continually having meetings and you are collecting someone's allergies in order to feed people at a meeting, that would be health data. Any kind of information about someone's physical or mental well-being would be health data. So not only are we going to discuss health care, but I want everyone to keep in mind that health actually applies to your company. So I am going to have this wonderful panel introduce themselves, and I am going to start with Dr. Cavoukian.
Good morning, ladies and gentlemen. It's a pleasure to be here. I'm in the privacy field. I used to be the Privacy Commissioner of Ontario for 3 terms. I'm the only one who stuck it out for 3 terms. I loved it. And then I was teaching at the university, and now I have my own consulting service, Global Privacy and Security by Design. Because what we have to do is ensure that we preserve our privacy. You never let it go. And we'll talk about that in the context of healthcare.
Good morning. I'm Alia Shahidi, and I'm the Director of Information Security Office at Ontario Health. I'm coming with a background in security and privacy for over 20 years, and right now I'm working with the provincial government, and we are a super agency for the healthcare sector within province, form of 22 actually organizations. And the focus is mainly again on the healthcare sector, and now expanding to the overall provincial healthcare sector, including the hospitals and all the healthcare service providers. And we are going to talk more about this.
Hi everyone, my name's Nguyen, and I'm the Industry Liaison Officer for the University of Guelph for a Master's of Cybersecurity and Threat Intelligence program. And prior to that, I've spent some time in IoT as well as in identity management, so we'll talk a little bit about that as it relates to healthcare.
Fantastic, thank you. So as you can see, we have an amazing expert panel today that covers a wide breadth of areas in privacy and security. So critical infrastructure, we talk about this a lot. We talk about power, we talk about other things. We certainly need to talk about healthcare. And over the pandemic especially, it has become a key target for ransomware. So especially with this pandemic, with everything that's happening, why do we think that healthcare systems might be more vulnerable to an attack? Why don't we start with you, Anne?
Sure. I think for a couple reasons. The first is money talks. I think there's a recent report that said that healthcare records can be sold for $240 versus a payment record, which is just for $5. And then when we think about a typical hospital room that has 15 to 20 devices in each room, each of those devices are connected, they have an IP address. And then we spoke yesterday, I think, a little bit about legacy systems. So these devices could be 20 years old. There might not be a patch available for them, or they could be end of life. And so mixing in clinicians who carry smartphones and tablets, that's a lot of vulnerabilities and opportunities for hackers to exploit.
Excellent. Ali?
Well, I'm going to say that we are not more vulnerable. We are pretty much targeted more. That's what I can say. The reason for that is that we, as Anne mentioned, there are so many good information that we are holding. In addition to the just concept of data exfiltration, that they can sell it or whatever under the dark web or whatever else they are doing, the main reason is that because we are really relying on this service and the digital world that we are right now offering any type of service, healthcare service that we are doing. So it's more than that. Just I'm going to say that selling the information is more if they can disable or hijack and basically take as a ransom the organization and keep them as a hostage. They can ask for millions of dollars to get the money back in order to release the information back to the hospital. We are talking about the human's life here. And the reality is that we are in the situation that we have to do it because it's not anymore that we can negotiate or be able, which at the same time it can be a bit tricky when we are doing that. So that's the area, that's the problem that we are. And ransomware has become number one basically attack vector for us because it's the easiest one and they can gain access to whatever they want and they get more money as much as they want from us unless we have our acts together and have need all of the security controls and backups and everything that we can and how fast we can come back to life again and bring back the systems back to operation.
You know, the risks are just so enormous with health information as well, in addition to all these excellent comments. Oh, sorry, I thought someone said something. The risks are enormous. Health information, your personal health information, is the most sensitive personal information that exists. And the potential for unauthorized access to that information is just off the scale. The harms that can arise from that are literally endless, because this is your health data. In the wrong hands and with ransomware, it can be compromised. There's so much that can go wrong. And we're talking about life and death issues which affect you in terms of your health care. So if your health care, your health data has gone amiss in any way, this can compromise your health in real time. It's a very serious matter.
Thank you. So again, we're talking about clearly the criticality of the information, and it's vulnerable information, it's important information, but also the availability of this information. So we can't afford to have the information not be accessible, from registering new patients when they show up to the hospital to operating rooms. We need to have that information when we require it. So we did call this a patch a day, but we know that for organizations, cybersecurity is a lot more than patching. So what is it that we should be considering, and hopefully for the people who are here and online, in terms of both small companies and big organizations, what should we be looking at to protect against these attacks in healthcare? Why don't we start with you again, Anne?
Thanks. I mean, patching is great and it should be done. It's like wearing your seatbelt when you're driving. If you're driving recklessly, it's not going to save your life. So there's definitely more that needs to be done. I come from an IoT space, and those embedded devices are made of so many components by many manufacturers. And so on the physical side, there's a bill of materials that itemizes and inventories all the items within those devices. But on the software side, I don't think that we hear a lot about the software bill of materials that are used within these devices. So for companies who put together this solution, they need to be able to have this software bill of materials so that when there's a vulnerability known, they have a plan. They either can patch the devices or they can isolate the devices, and we don't put the people at risk who depend on these devices. And lastly, in terms of small and large companies, I think I've seen some large organizations have the ability to have larger budget, so they're more mature in their cybersecurity. They have larger programs, and because they have a larger amount of data that they're trying to protect, that doesn't mean that smaller organizations aren't at risk, because hackers will go after the smaller organizations just to ensure that they're testing out their tactics before they go after the big fish. And so at a smaller organization with less budget, perhaps their efforts should go towards really educating and creating cybersecurity awareness on a regular basis versus doing it once a year as part of a checklist.
That's fantastic. And again, we need to consider vendor management, as you're alluding to, too, in the systems that we select and how we're looking to build in that system. Ali?
Well, the patching concept, as you mentioned, it's one of the aspects and one of the controls, but the reality is that we need to look into that defense in depth when we are talking about protecting an environment. And Right now, the zero trust type of concept that has become one of the buzzwords in the industry in general, that's where we need to look into that. Patching has been always one of the most challenging parts of the operation, security operation, due to the resource management, due to the legacy environments, due to the age of the organization, and sometimes even the applications that they are using on those systems. We are dealing with all of those type of challenges as we speak. And the problem is that we need to have always an up-to-date currency operation in place that can always look into the systems. Number one, we move them from the legacy environments and legacy, because this goes back to the age of the organizations. And if we have still maybe Windows 2003 servers in some areas that there is no patch for it. The reality is that, and they cannot retire them because at the same time there are some dependencies in there from the operation side. So when we look at all of that, the reality is that patching is one aspect which is very challenging to achieve due to resourcing that you mentioned, and the other part of it is going to be all other type of controls that we need to put in place in order to make sure that, as I mentioned, the defense in depth, all the way from monitoring to endpoint protection and EDRs and everything else are in place in order to prevent any type of data leakage or ransomware or any of those areas. So yes, patching is important, but it's very hard to achieve because there is no organization in this world that can claim that they are always up to date 100%.
Yeah, that's a great point. So it's a journey, not a destination. So we are trying to get to this best point with cybersecurity and privacy practices. Moving a little more into privacy, because that's where Dr. Ann and I come from. And for those who may not know, Dr. Ann was involved in the creation of Privacy by Design, which is what we use to ensure that we have privacy in the foundation of everything we do. One of the key points in all of the privacy regulations we have is data minimization. And that is collecting only the data you require minimally and using it only for the purposes for which you have stated that you will need that data. So Dr. Ann, certainly over the pandemic, we have created new health apps, new ways of doing healthcare online and virtually. What do you see are some of the risks about the way we are doing this in terms of the data we're collecting and handling?
One of the major concerns I have is there has been such a fast response in creating all of these new areas. The necessary thought that must be devoted to how do we protect the data is just waning. When I created Privacy by Design many years ago, the reason I did it is I wanted people to be proactive about preventing the privacy harms from arising. Bake privacy protective measures into the code directly, into your operations. Don't make it an afterthought. Don't make it something you're going to address along the way. And when I talk to CEOs and boards of directors, I say you have to emphasize the proactive nature of privacy and privacy by design. And if you do that, what you also have to do within your organization, you don't just have a privacy department over here, and then there's everybody else in security and all your administrators. No, you have to work together. It has to be a blended operation where people understand the vital need for privacy, wedded to security. You can't have one without the other. And this has to be conveyed. So with new measures that arise when you have a pandemic or an emergency situation, often those kinds of activities are overlooked. And that's the problem, because the pandemic will pass. Many emergencies have arisen and passed, but the old way of doing things doesn't necessarily return in terms of being proactive and embedding privacy into design, et cetera. And you continue with the patchwork that has been created to respond to the emergency. That is such a lost leader. It's going to end with massive, massive disclosure of personal information, whether you like it or not. So please take the time and secure the information, understand the privacy-sensitive nature of the data, and make sure you have complete data minimization from start to finish.
Amazing, thank you. And so, Ali, we had talked about people asking for things online. For instance, let's say, send me a copy of your health card because I can't see it. What are companies doing wrong and healthcare organizations doing wrong in terms of collecting this kind of data?
Many different. The problem is that, exactly as Anne mentioned, that because we are, especially this pandemic brought so many new things to us that we needed to just stand up very fast in order to respond to the situation. And I have been involved in many of them, and since this COVID started. And one of the areas, for instance, even the doctor, my own physician, she sends me the lab results by email to my Google. Come on, that doesn't work that way. So the reality is that we have been challenged by this pandemic, and one thing that also Dr. Cavoukian mentioned, that privacy by design, we started saying that let's do it the security by design from the end to end. And one thing that is missing in this area is, again, the expertise in the domain, especially when it comes to the smaller organization in healthcare sector, all the way from the clinician offices to the even smaller, that we have, we call them mom and pop type of shops, as healthcare service providers, which is by design. They need to be there. We need them. They need to be there. They might be in the northern territories that we don't have a larger organization that they provide services to the public. But the reality is that they are missing the point that what type of privacy and security they need to have in place. And they are using their personal devices, they are using personal email, and one thing that we have said, and always we have tried to prevent, is sharing PHI or personal health information over the email, because email is one of the most vulnerable platforms. And we don't know who's accessing it, where they are sitting. And when I mentioned, for example, Google, we know that they are collecting by design, and they have analytics that they can read, and they can basically store all of the information in there. So that has been a challenge. And other platforms that they have been used for, even virtual care services that they're providing, using unsecure and the ones that they don't have any type of privacy, platforms that are used for meetings or those type of things, that they might come with recording, they might come with sharing personal health information, PHI in there. So there have been so many considerations that we have had. One other factor that we need to also consider is the end user from the other side, because not everyone is tech savvy. Not everyone has a proper computer or mobile that they can access them. So at the end of the day, and so many are elderly that they don't have the knowledge, or they don't know the technology, that they can share those type of things with many others, and those. So there are so many considerations that we have to put in place when it comes to the virtual care, and how we are providing service now with this pandemic situation, or any other type, that we have to be on the digital board.
That's great. And what are you finding with tools that you're using? Are you using anything different to collect this kind of information?
I think from a team collaboration perspective, we're definitely more in line collaborating. Collecting information is definitely more virtually, but I think it goes back to just continuing to reinforce and educating the team members that are working hybrid, because I think a lot of organizations, they're not going back completely into the office. They're allowing some administrators to work from home a few days a week. And really, when it comes down to, if you step away from your office and you have kids, your kids could be trying to access free Roblox games, and so you really have to really educate and get them to be vigilant.
That's excellent. All right, so I don't have a soapbox, but I do have a podium. I am going to complain a little bit about one thing I have with privacy regulations. So we have PHIP in Ontario, we have privacy regulations in all of the provinces. We do not define security safeguards in any of these privacy regulations. HIPAA does. If you go down into the United States and you're producing something from a medical perspective in the US, HIPAA has some very stringent security guidelines, especially around re-identification. There's some great stuff down there, but we do not in Canada. So as a healthcare organization, if you're being provided with a privacy regulation and it says, you minimize the collection of information, use privacy by design, we aren't actually telling companies how to protect their data. So we are missing that element, which makes it very, very important from a cybersecurity side to come in and make sure we are actually implementing those safeguards, as everyone has said. So Dr. Ann, we have moved to virtual healthcare appointments, and this brings up, I could see the sigh. This brings a whole litany of other issues. So what should companies and organizations be aware of with that?
What makes me really nervous about a whole virtual area of healthcare, and I understand why it's taking place with the COVID world. I mean, virtual care has benefits, there's no question, especially for the elderly who can't go to offices, the doctor's offices, et cetera. So I'm not slamming it, but you have to have the necessary privacy protective and security measures associated with this. So unauthorized third parties can't gain access to it. I mean, this just strikes me as such a given. It's shocking that I even have to say this. Like, who wouldn't be aware of this? You would not believe the number of virtual sessions that are not protected in any way. Other family members can gain access to it, unauthorized third parties. This is your sensitive health data. You're telling your doctor about all the ailments and things that are bothering you. Are you kidding me? This isn't strongly secured. It has to be. So one of the things you can say to your doctor, which he or she won't appreciate, is just say, oh, I'm so glad we're doing a virtual session. You've got this strongly secured, right? Can you tell me how you do that? They'll laugh at you, hopefully, before they hang up. And that's the problem, is you may jeopardize the ability to engage in virtual healthcare, but at least you could raise it nicely and just express your concern. And I find sometimes when you express your concern and interest in privacy and security, they will take additional measures. They might say, oh yeah, one of my staff mentioned something about that. I hadn't really done it. You care about this stuff, right? Okay, we'll protect it. I know it sounds silly. That kind of thing happens all the time, unfortunately. So please take the additional measures and raise the consciousness, awareness of your physicians, et cetera, who are engaging in these virtual exchanges.
Yeah, Ali, you had some tools that you were talking about that were better or worse for this kind of thing. What do you think?
Definitely, we have many different tools, as I mentioned. There are, we had to do tons of work on some of the tools that we have been working, all the way from OTN or from our side that we have been involved with, especially providing care to, not from the hospital side, if you think about all of the legacy, we call them legacy lanes, and the home care service providers, that they have been providing service to the elderly, to the ones that they needed service, or they are disabled, or all of those areas. And we had to come up with, for instance, a mechanism in place that we could at least have minimum requirements. And the other part of that is majorly going back to the awareness and training of not only the staff members and the ones that are providing, because the ones who are in healthcare services, their job is providing healthcare. The reality is that they don't care about security. That's not their priority. Their priority is saving lives. They are providing. So the challenge is that how are we going to educate them and raise the awareness among them that, you know what, in addition to what you are doing for saving lives, you need to also save the privacy of those lives. The other aspect of that is in areas that we are basically, even the IoTs, Internet of Things, that we are relying on them, and everyone is going that path. So in our case, we had to come up with a unified type of technology in order to do that, with very restrictive type of policies in place that we put in place, making sure that even though we are making it very fast to achieve the goal and make sure that we are not basically disrupting the service, at the same time we are providing the minimum requirements for both privacy and security. Is it 100% safe and secure or private? No. The reality is that no. But at least we have done what we could do. The rest goes back to the basically the users. And as Anne mentioned, that even the patients at the end of the other side of the line might not be able to use the technology. They need additional help. Is that going back to the private side? Is that private? Maybe, maybe not. So the consent and all of those policies and good things that we have to consider when it comes to PHIPAA and IPC requirements, we need to consider them, and those are the minimum. But the biggest challenge we have been facing with across the board has been the, again, usage. You see, we are providing this as a centralized solution. but not everyone is using centralized solution. They are going off, using Zoom, for instance. That is for 100% non-secure and private. So those are the areas that, yes, we have been challenging the other side, and hopefully we can raise the awareness that that's not the right way of doing the providing the service.
That's great. And that's a great point about existing tools. We are using existing tools because it was what was available to us. I would like to issue the challenge to anyone here who has the ability to either create new tools or to select new tools that we're going to do better. We are going to ensure that we have better tools that have limited access. I know I'm privileged or not privileged, depending on the perspective you look. I did a lot of privacy impact assessments over this pandemic on new health tools because new companies were coming out and saying, hey, we've got this new thing. Most of the provinces will require that you have a privacy impact assessment done on your tool. And a lot of it was challenging access control. So when you consider where hospitals came from, where there was literally a file folder at the end of someone's hospital bed, everyone who could come in that room had all access to the entire file. And so what's happened is some of these companies have moved that concept online. And now everyone has access to the file. So these electronic health records, everyone has access to that file. But we don't need to do that anymore. We can do better now. We can say, here's your role, here's your access. And because we don't have it in a physical space, because we have it in a digital space, that access is obviously global and far-reaching. So we need to ensure, like Anne had said, with remote access, now people are coming from everywhere and reaching into these files. So we do want to do better. In terms of intelligence sharing around some of these vulnerabilities that we have in healthcare, Alia, I know that there's a program that's being started. Can you tell us a little bit about that and any kind of thing around bug bounty programs and how that's going to work?
Sure. Since last year, actually, we have started across the province a new program with the Ministry of Health and MGCS and many other organizations. We have started coming up with a new operating model for the overall province, healthcare sector I'm talking about, in partnership with, as I said, the ministry and many other players. We have basically in this new model that we are right now running a pilot project, which is now a public known type of initiative. We have divided the whole province into 6 different regions that we are basically trying to provide or bringing everyone to the same level at least, or to raise the bar, not only for the larger organizations and healthcare service providers all the way from larger hospitals to the smaller ones, as I mentioned. In this program, we are trying to provide, because one of the areas and challenges has been always resources, as I mentioned, for everyone. It can be funding, it can be basically human resources and talent in the domain. That's one of the areas. We have lack of talent, and we have so much right now demand for hiring, finding the right privacy and security both that can help with our organizations. So in order to fill this gap for the overall Ontario, we have come up with this plan. And as I mentioned, we have started this pilot project, which is 6 regions. That means that each region is, or we call them RSOC and Healthcare SOC, which is the Security Operations Centers. The RSOCs are going to be divided into local, regional, and then overall provincial level, where we are going to share basically resources, not only from internal, but also bringing in vendors that they can use as, we can use them as MSSPs in order to provide the security services all the way from monitoring to instant response, which are all of the high demands for us, in addition to any other type of services, such as one other thing that we have done and I can talk about is that we are bringing, we are introducing a new centralized tool for security assessment across the board, where we are going actually down the level at the physicians' offices. They're making sure that basically, and it's going to roll up everything to the ministry and to us, looking at the overall province and see who has what and where the gaps are, and where we can help them with the overall. And not only us, I mean, I mean the overall, the bigger players in the domain, to help the smaller organizations and the service providers to achieve the minimum security requirements, all the way from EDR, endpoint protections, and as I mentioned, incident response, threat risk assessments, all those type of things. So that's a program. The pilot project is going to end by the end of 2020, fiscal year 2023, and which means next year. And then we have a plan to move forward with that for the rest of, basically as a program that we are learning lessons now from, and we are trying to fail fast to see where the gaps are, and then we can move forward and make it more robust as we go forward.
If I could add to that, having spent some time engaging with a lot of CISOs and healthcare security professionals, in the past when I've talked to, organizations in the rural area where there's not one single person that's accountable for security and risk because, like you said, there's just not enough resources in the GTA. You'll have a CISO at those hospitals. So it's so great to see that our rural organizations are getting so much support that they need.
Absolutely, yes.
Fantastic point. All right, I would really love to stop using the sentence, the weakest link is the human link, but I'm not going to because it's true. So I'm going to come to Dr. Ann, especially around privacy. How should we be training staff to better handle this kind of information?
I always like to give them real-life examples of what can happen if you don't protect the data. Because often that's missing on people's minds. They think, well, what's a big deal? It's just, it is enormously important for people to have a real in-depth understanding of the harms that can arise when you don't protect personal information, especially in association with health-related medical data. The list just is endless. When I was privacy commissioner, a number of people came to me with complaints that their health information had been breached and how it was devastating in terms of how it was affecting their lives. And then, we tried to fix it and issue remedies, but after the fact, it does very little. Once the data is gone, the harm is enormous, and retracting it and trying to get it back to be safe is an extremely tedious task. So please impress upon people how enormously important this is, and create measures that they can use. I always say when I go to organizations, do you have a data map? And they look at me and they go, huh? And I say, do you map the flow of data throughout your organization? Because usually the first time it's collected for the primary purpose, healthcare, that's consented to, everything is fine. But then it can travel throughout the department to various areas, throughout your organization, to various departments that may not need it or should have it in some kind of de-identified manner or encrypted or something. There are a number of protections you can associate with it. So raising awareness goes a long way.
That's great. And how do you deal with training staff?
I think when it comes to training and staff, that frequency is really important. I think people will retain information depending on how frequent they're exposed to it. So cybersecurity education shouldn't be something that we do in October because it's Cybersecurity Awareness Month. I think some of the top organizations that I've seen, it's part of the regular leadership bulletin. It's something that's talked a lot about frequently on a quarterly basis. And I think it doesn't hurt to also make it fun. There's some organizations that gamify it and they celebrate the people who do great on those tests and results.
That's great. Ali?
Well, I'm not sure if I should say that or not, but the weakest link is always, we know that, it's human. No matter how much controls and how many controls we have in place, at the end of the day, it's all about training. It's all about awareness, and it's all about building the culture. I call it culture because if we look at it from the security or privacy as a cultural thing, not only at our own workplaces, but in general for our lives. Even if we are walking on the street and we are looking at all of these cameras that are around us, at intersections or at homes cameras, all of that, we need to consider the security and privacy of all of those. I used one example that a few years ago, nuclear command controls in countries have the highest basically security rating in the world because we are dealing with nuclear bombs and all of those. In US, there was a report that they had all of these controls in place. It's amazing controls about what I'm talking about, but the one who was operating this, they found out that he was sleeping during the shift. So no matter what we have in place, if we have that type of human flaws in place and not awareness, then it's not working. Or we come up with crazy type of password complexities, and then we force the user, because they forget, put a label on the monitor with their password. So the awareness training is the key in here. And then again, that's, I think, the fundamental for any type of security or controls that we have to put in place.
That's great. And again, it's not a once a year thing. So if we could all have a t-shirt here that says not once a year training, it is all the time. And if your organization is dealing with health data, it's important to also train them specifically on the health regulations that apply. And again, as Dr. Nguyen had said, the importance and vulnerability of that information. Some regulations require something called an oath of confidentiality, which is essentially, it's like an NDA, but it's an NDA for other people's information. I love them because then it forces someone to actually read through and say, if I find this data accidentally or intentionally and I'm not supposed to have it, I will not disclose it, and then they have to sign off on it so you know they've actually looked at that. We have a couple minutes. I would love to take some questions. I know our staff is running around with those boxes, or microphone boxes. I kind of see one in the mist over there. Does anyone have any questions for our wonderful panel?
Hi, my name's Scott. I work in the cybersecurity and privacy practice. I'm just curious if we're going to see some of the government agencies, whether it's NRC or Cybersecure Canada, Ontario Telehealth Network, adopt more internationally acceptable standards and frameworks and methodologies. What I hear a lot from customers, specifically in the space, is there's one cybersecurity for telehealth network, which is a HTRA and a PIA. There's another one for the Canadian Cybersecure, but it doesn't actually meet their business needs, because that's fine if they want to do Ontario Telehealth Network, but that's not going to help them when they move to Quebec or they move to another geography altogether. Is there any thought within, I guess, Alia, this is mostly directed towards you, trying to standardize on industry accepted standards rather than something that's being created locally? Thank you.
I'm gonna. Absolutely. That's one of the areas that I mentioned that we are working that provincial operating model. Standardization is one of the key concepts in here. The province has approved to be, the very first thing that we had to come up was the framework that we have approved to. The province actually has approved to use NIST framework instead of any. We had a mixed bag of everything in the past, and everyone, you're absolutely right. We're doing in different ways. Even with the OMD and OTN that you mentioned, because OTN is now part of Ontario Health, we are following the same type of standard, and the security assessment tooling that I mentioned is based on the NIST CSF framework that we are using now, and we are onboarding actually some vendors to help us with that, the unified and centralized view of the overall. So that's absolutely, that's what we are working on, and because we need to, even we have been in the situations that now we have to map the older type of frameworks, because all of a sudden we cannot force everyone to do that. But we are trying to, or HTR, the TRA that you mentioned, that's what we are trying to centralize again from threat risk assessment concept, making sure that even as I mentioned, at the physician level type of offices that are the smallest entities in here, they are going to follow, but at a smaller scale, because something that we are offering and we have the controls and the resources at the larger hospital, it's impossible to ask that from someone that is running a small office. So we are trying to come up with different scales, making sure that at least they are following the same, but at the different scales and with the different type of controls that they need in place. I hope I answered your question.
Is there one more question?
May I take one more here? I'm Ali from University of Guelph. Just wanted to know, because I was hearing the emphasis on staff training, employee training through the discussion today. Is there any data suggesting the return on investment on those staffs and compared with technology, if you came across, right? Because in our communication with different clients, we are finding that, especially from top management point of view, the ROI of employee training on cybersecurity if the employees are moving, and they're moving fast these days, may not justify. And as you know, there were many technologies developed to make everything automated. And now with the human in the loop move that we have for AI, the pushing to pack humans in the control and then reintroducing all those risks that we were trying to address to mitigate. Just wanted to know whether the panel has any exposure to those kind of data, that whether the ROI makes sense on the employee training, and if it is, how comparable it is with technology investment. Thank you.
Thank you. So anyone on ROI on training? Dr. Nguyen, you want to?
What I want to say about training can be ROI, AI. You always have to, first of all, training has to be ongoing. It can't be just, when you first join the organization or whatever. It has to be ongoing, hopefully quarterly at the very least, and that's critical. But the essential need involved in the training, every individual doesn't have to know what's taking place throughout the organization. There may be too much complexity involved if it's not related to your area. Have the specific training directly related to the individual's area, the work that they're doing, plus an awareness of what else is taking place so they can have an understanding at a higher level. But what they have to drive home is the vital importance of what they're working on and the training that is needed to secure their data, the health-related data for security, privacy purposes, an explanation of why that is so unbearably important, unbelievably important and critical, and the enormous service they provide in focusing on the training and providing the proper services. When you can drive this home again and again, I think it also instills a sense of confidence and understanding in the individual of how important their work is in terms of the role that they perform in securing the data and ensuring its protection.
Fantastic. So I'd like to thank my amazing panel today. And so again, as takeaway, please protect your health data. Thank you guys very much. If you have questions, we'll be around, and enjoy the rest of the conference.